Good evening, everybody. Welcome back. I'm Dr. Anita, and I speak to you about Parkinson's disease today and the caregiver concerns. Right? So today, Parkinson's disease is the second most common neurodegenerative disease after Alzheimer's disease. Right? It is a chronic condition again. And if you find the following signs and symptoms in your patient, there could be a possibility that he or she is suffering from Parkinson's disease. So there are three cardinal signs. They are rigidity, tremor, and bradykinesia. So if your patient has tremor, that is resting tremor, then he might have Parkinson's disease. But if he's having just general tremor while picking up some object or doing some work, it does not necessarily mean that the patient has Parkinson's disease. Also, there are certain motor symptoms and non-motor symptoms. So I will tell you what are the symptoms for Parkinson's disease. They are tremors, walking difficulty, changes in posture, loss of balance, repeated falls, depression, dementia, excessive sweating, drooling, urinary symptoms, autonomic symptoms. There is difficulty in passing stools, which is constipation. There is orthostatic hypotension, where your BP falls when you stand up from a lying down position. So these are sort of some of the symptoms that can indicate that your patient has Parkinson's disease. As I told you before, there is no specific diagnostic tool that will determine that the patient has Parkinson's disease. It is only on pathological basis that you can determine the presence of Parkinson's disease. Also, in terms of treatment, there is one drug, L-DOPA, but again these are only for symptomatic treatment, that it is not an exact treatment for Parkinson's disease. Also, now I would like to concentrate on the caregiver concerns, which is important. Caregivers are you, people like you who take care of patients, which is can be your mother, father, brother, sister, aunt, uncle, anybody, right? So you have to be putting on several hats, and caregiver burden or caregiver fatigue is a big public health problem, because caregiver fatigue can lead to decreased quality of life for your patient. Hence, how to avoid this caregiver fatigue? Firstly is to have your social well-being. Go out, enjoy life as well. Take time off your busy schedule to spend time with friends or other family members. You can also go and have fun with your other friends, if whoever you like to spend time with, right? Also, you have to ensure that you speak to your patient in a stern manner when they get physical. For example, some patients tend to have a sexual drive even though they are older and affected with a particular disease, but the sexual drive is not lost with age. Hence, they tend to make sexually inappropriate statements, which might take you aback sometimes, but you will have to speak to them in a stern manner. Also, you must remember that this is you have to go into caregiving with a multidisciplinary approach. You cannot be alone. You need to be having help from other doctors, other neuropsychiatrists, psychologists, dietitian, physiotherapists, occupational therapists, etc. Only then can you take care of your patient. So I suggest that in order to let go of this fatigue, you must take help when needed. Ask for help when needed. Thank you so much. Bye-bye.